Welcome back to this episode of PCTV's Favorite Things. You know, we all want that glow and that smooth, beautiful skin, that natural, fulfilled face, but we're not sure how to get it. Today, I welcome our guest to the show, Hillary Taggart. She's a nurse practitioner with a doctorate in nursing. She's been doing cosmetic injections for almost a decade, and she's worked for top plastic surgeons and top medical spas here in Utah. She also teaches classes at prestigious schools, along with teaching physicians and nurses. So I'm so excited to introduce her to all of you. Hillary, thanks so much for being here with me today.
Yeah, thank you, Noelle.
Gosh, it's been just so nice to get to know what you do and just listen to some of the responses that you've been having with me. So I want to talk about what you do every day.
Yeah, so as a nurse practitioner, I have my own cosmetic injection practice located in the Sugar House, Mill Creek area. And honestly, I like to describe my day as hanging out with women all day. I feel like I have the best job. Women, mainly women, definitely some men as well. We get to hang out and problem solve. Women come in and have a few concerns here and there, and we get to talk about them and address those issues and help them feel a little bit more confident about themselves.
What is it like as a patient coming to Dr. Hillary for the first time?
That's a great question. I think a lot of people are in this industry, there's two things. One, there's a lot of fear around this industry. We hear that cosmetic injections, you can look natural, but a lot of times we don't see that because we see people that maybe our neighbor or our friends that get things done and they don't look natural. So we perceive that the whole industry, the results are you're not going to look natural.
Right.
And that's not true. That is true for some, right. But for every person that you see that might have the infamous duck lips or whatever, there's plenty of people that look really natural that do get things done. One of the most important things, or three things that I kind of say what creates a natural result is number one, the product. So as you can see here, we've got several different, just kind of my top favorite products that I use. So the product, they have different properties to them. The quantity. Mm-hmm. So yes, sometimes we want to be filled and not volume loss as we age, but if you do too much, then it doesn't look right. And then the third thing, of course, is the injector. The injector needs to have the skill and the knowledge to know which products to choose for which clients and how to inject them appropriately.
And I think it's about asking the right questions
Yes.
to the patients, as well as us as patients asking those questions to the doctor,
Yeah,
right?
absolutely.
You know, we want to look this way, but how do we achieve that? And I think that comes with probing questions. Well, let's talk about really what are the problem areas.
Yeah, it's so true. It shocks me how many times clients come to me, and as I start to get them numbing or whatever, and we're prepping, I ask them and I start to say, okay, well, what kind of results are you looking for? Are you looking for this or are you looking for that? Because the thing is you guys don't know what questions to ask all the time.
No.
So I know what kind of different results I can provide, so I ask a lot of in-depth questions. And the thing that really shocks me, frankly, is that so many people say, I've never been asked these questions before by another injector. They normally just come in and inject me and leave. And I think, well, how could they do that? Every single client that comes in has a different idea of different results that they want. So I ask very in-depth questions, sometimes the same question 3 different ways, to make sure that that client understands and that we're both on the same page, so that when I inject in a way that's going to get her or him the result that they want, not their best friend,
Sure.
not their sister, because everybody's different and everybody's face is different.
I think it's scary sometimes to go into an office with an injector and you think you can go in for 10 units and you come out with 50 units, and that wasn't part of the plan.
And the funny that you bring that up, because that's another pet peeve of mine. I frequently hear people say to me that they go in and they kind of talk about things, and then as the injector is going, they say, well, you know, you need a little bit here, we're just going to add a little bit here. And literally, I've had people tell me that what they thought was going to be $500, they go to check out, and without a word from the injector, it's $3,000. And I think that is ridiculous and actually very unethical in my mind. So I am very clear about my pricing up front. Yes, a lot of my clients are willing to spend $3,000, but that's not the issue. The issue is whether your budget's $200 or $3,000, there needs to be communication so that everybody's on the same page and there's no surprises.
I'd like to have Dr. Hillary maybe do a few injections on me and let you know kind of what that looks like and what we're trying to achieve when we come back.
Yeah.
We're back with Dr. Hillary talking about facial injections and things maybe you haven't heard of before. So we're going to do a live demonstration on some things that are actually troubling me. Dr. Hillary, here's what's challenging: my neck, some places around my mouth.
Yeah, so it's really common when people think about Botox or Dysport, which are both neurotoxins that help reduce the muscle movement. Oftentimes we're thinking in between the eyebrows here for those 11 lines, or these forehead lines right here in the crow's feet. And although those are very common areas, some of the other areas that we're going to do today is actually these platysmal bands. So when we go like this and these lines kind of pop up, what happens sometimes is it pulls down on our jaw. So by injecting these platysmal bands, it kind of relaxes, it kind of helps reduce those gels. Another common one that I like to point out, because this has to do with pain, and a lot of people don't know about this, is the jaw. Actually, for people that clench and grind at night, you can do Botox in this masseter muscle, and it'll reduce the clenching and grinding. So a lot of times people wake up in the morning because they're clenching and grinding all night during stressful situations such as 2020. So
yes.
I really like to do in the jaw masseter, or the masseter muscle in the jaw, and then also these platysmal bands. So I've got everything all ready. Should we go ahead and do some injections?
Let's do some injections.
Okay. So of course, we clean off with a little bit of some alcohol to start off with. And then we've got this vibrator, and this vibrator, what it does is you just hold it.
Tool.
It's the best thing.
I actually just think it's a distraction.
It is. That's all it is it literally distracts and makes it so that your nerves sense the vibration instead of the poke. So go ahead and go like that for me. Perfect. And these are just tiny little needles that I use, and we just go right here into these little muscle bands.
And it doesn't hurt at all.
No, it really...
The needle is extremely fine.
People frequently tell me that they expect it to be a lot more painful, and it's really not. Tilt towards this way for me, would you? You want to put that on your chin?
I would love to.
But it's really not even bad even with it. And so we're just doing a couple units here, and there's not really much downtime with this. Botox starts working in a couple of days, and then we'll start within 3 to 5 days and take up to about 14 days to totally work.
For smoother, more youthful look when you're, in your mid-40s,
Yep.
I'd say not a bad idea.
Not a bad idea at all.
Not a bad idea. You're amazing for being here and sharing so many of these tips and the customizations that you do and the time that you spend with your patients. I loved everything about it, and I know all of you will as well. The show giveaway today is $200 towards anything that Dr. Hillary offers, all the services that she offers at her practice. Thanks so much for joining us on this episode of PCTV's Favorite Things. We'll see you next time.